that's the purpose of an adjustment, to take all tension out of the body neurologically, structurally, muscularly, so everything processes fast and well, so you have a great day.
So come on and jiggity jack yourself before you wreck yourself.
Well, hello everyone. Today I have an amazing guest here. Her name is Jamie. Hello. Jamie here is a nurse for a major hospital in the Southern California area. And I wanted to have her share with you her journey here. So, Jamie, can you share with us what brought you into our office?
So, initially, before I started, I had some numbness and tingling in my hands that would travel up to my arms. And I knew that wasn't good. But it was new, so I was like, oh, maybe it's just like, your hand falls asleep. It's not anything major. But it kept happening every few weeks, and then it was days, and it was just being more consistent. So I started telling my mom about it. And I was like, oh, if I tell her, she's going to be like, you have to go to the doctor. You have to do something. But I was like, no, it can't be that bad. So I had seen chiropractors in the past, but because of the pandemic, didn't see anyone. And my health kind of declined, and I was going to be a bedside nurse, so I needed to do something. And funny enough, my mom found you on Facebook.
Mama found me?
Yeah.
Awesome.
On Facebook.
Yay for Mama.
So Facebook ads work. Because you popped up, and she was like, there's this chiropractor. She sounds amazing, and she's literally down the street from where we live. So I was like, is it a sign? Like, I need to just go. So I went. And I did the consultation. I loved everything about Dr. Syn.
Well, can you share with the audience the consultation process? What was unique about it, and what did you like about it?
Sure. So, like I said, in the past, the other chiropractors I went to, I would just go in, go out, and that was that, just from palpating. But Dr. Syn...
So for the audience, palpating means just feeling with the hands.
Yeah.
Right. And so... from what I understand, your past experience was they didn't take much of a history and they didn't ask many questions pertaining to your overall health, trauma history, or lifestyle or ergonomics to really understand what was going on with you and how you got to the point you're at, right?
Definitely.
Yes.
Yeah, so Dr. Syn actually does a full body scan of the spine with x-rays and then nerve assessments. And then she told me I had scoliosis.
Yeah, she did, and it's getting better.
And of course, I had no idea that was happening, and the x-rays were there to prove it, so it wasn't fake information.
Absolutely. So what we do here is we take a baseline measurement of an individual's nerve imbalance, muscle imbalance, and skeletal imbalance. So if the bones are crooked and locking down on the nerves, you're going to have some malfunction where the nerves exit and flow to destination muscles or organs. So for Jamie, we did a complete analysis of the structure, nerves, and muscles and figured out what actually is causing her symptoms.
Yeah, so we did the consultation. We did, like she was saying, a full history intake and exam. And it was just breaking down all the information, seeing what else contributes, just my lifestyle in general. And being a bedside nurse is taxing, especially on the lower body. And standing, running, sitting maybe for 12 hours or plus longer definitely took a toll on my body.
And might I add, she has a very, very demanding schedule. Sometimes she has back-to-back 12-hour shifts at this hospital, so you can imagine the amount of load on her body.
Right, and I was already dealing with insomnia because I also have hypothyroidism, so my hormones have always been out of whack for the past decade, I would say, and they've kind of normalized here and there, but a lot of factors contributed to my health not being so well recently, and then my organs, my nerves, and just the spine in general. So
yes, so some of you have gone through the corrective process here because you're already clients, and some of you are new to me and my office. But yes, I do a full education during the course of corrective care so you understand your body. So it's like having an owner's manual. Like if you get a new car, you need to know where all the buttons are and what does what. If you get a new phone, you need to know exactly how to operate that phone. So my process here is to help people understand what's wrong with their body, what's causing it, and what can you do at home to help yourself get healthier and stronger and more energy and feel very, very here. What that means is, like, I think you shared you had some brain fog as well.
Yes, I did.
And since getting care here, how is that?
It's definitely improved a lot. I mean, even after one adjustment, when I first started, my mood completely changed immediately. It wasn't like it took time to see, which was really great.
And may I add, here's the neurological reasoning why. The upper cervical area, C1 is called atlas. We have 7 bones in the neck, 12 bones in the mid-back, which is the thoracic spine. By the way, the neck is cervical spine, neck is thoracic spine. Lumbar spine is lower back, we have 5 bones, and then you have the pelvis with the triangle bone underneath the lumbars, which is called the sacrum. So when Jamie is sharing with you her mood instantly got better after one adjustment, in the upper spine, there are nerves that can communicate with the frontal cortex and the prefrontal cortex. That's where your body processes information and is able to have neurotransmitters communicating and have you have mood up or move down based on how the nerves are communicating with the brain. So when we do a specific, not just a crack, but a very specific, directionally vector specific adjustment to the cervical spine, it unlocks the nerve supply to the prefrontal cortex. And so then your mood starts to regulate better. So I hope that makes sense.
Yes, so definitely everything just elevated. I mean, I think within sooner than a month, I completely had a lot of the symptoms disappear or minimize.
Yay!
I haven't even had numbness and tingling in my arms, and that would travel up to my shoulders and back in, I don't even know how long, because it's been that long.
Right.
Yeah.
And recently we took some progress films.
Yes.
And we had some really good, amazing changes. And so what I do here is I take baseline films, take measurements of your curve angles, where they're deficient and where they're excess. And then you go through a course of treatment, exercises, lifestyle modification, and then we take progress x-rays. So we are actually comparing apples to apples instead of just one x-ray in the very beginning and no x-rays ever again, and tell you, you're feeling better, so I think you're better. There is no think. Everything is data driven so that you know and I know that what you came here for, you're actually achieving.
Right. So the results are there. I mean,
Absolutely.
It's not just the initial consult and intake and, okay, this is what's wrong, help me fix it. And as we're progressing, you know, every few visits we're doing nerve assessments, and then, like she was saying, the film x-ray again of the spine, so I could clearly see the difference. And then even from my chart, the angles that were all messed up, everything had just been clear to me that things were improving. And it was speechless, really, because my mom was like, what is she giving you? Like, there's a secret or something, because like you're a different person now. And I was like, you're becoming the old Jamie now, you know, that's what we want to see. And I had forgotten about who that person was, really, you know.
But now you're back. She's
Better than
back. Yes, awesome. So getting the right kind of chiropractic care can really change your life. And I mean change your life for the better. So I'm now going to have the privilege of adjusting Jamie. You guys all get to watch. Are we ready?
Yes.
Okay, let's get to it. Okay, so here is Miss Jamie, and she's laying face up. Sometimes I start my clients face up, sometimes face down. It depends on what I'm suspecting on that visit. So I am going to assess her leg length first. Whether you're face down or face up, I always check leg length. Why? Because if you have a short leg, that tells me you're not bearing weight equally with your both feet planted evenly, and then the body weight being supported correctly. So I'm gonna check Jamie's leg length. Okay, let's get a close-up. So clearly Jamie's left leg, can you see it here, Dina? Can we show it? Jamie's left leg is a little more than an inch shorter than her right leg. So if I go like this, they're not even. Okay, now I'm going to do an assessment to her cervical spine very gently and very specifically to see which way the rotation is happening in the upper cervicals. So I'm going to neutralize and adjust the C1 area, which affects her mood and her energy and her cognitive function, and then carry on assessing the rest of her spine. C1 is like the master switch. It controls so much, and all the nerves that control all the body functions originate at the base of the skull. So that area is a key area to keep so I was going to use a word, but y'all don't know. It's called unsubluxated. It means not misaligned. So we're going to check for misalignments, especially in the C1 area. Okay. So I'm assessing her head and neck, and her right ear is higher than her left ear. So this is a neutral line, and her head's doing this right now. So I'm going to challenge nerve tissue on the one side to rotate and unrotate temporarily. Okay. To see if any direction at C1 or C2 causes a neutral leg length. And I found a direction. So, Jamie, I'm going to ask you to lay right side down, please, okay? Okay, temple goes on this little support square. Good job. Good. So Jamie's leg length balanced out when I did a left side clockwise challenge. So I'm going to adjust her accordingly. All right, love. Her C1, I'm going to actually move it anterior superior. Good morning. That was a love tap, by the way. All right, let me reassess you. Let's go face up. All right, can you bring it in? This Jamie is now even. Yay, no place like home. Okay, good. So the rotational component is now resolved. That means the tension that's torqued on her C1 is handled. Now I'm going to palpate the rest of her spine to see what else needs adjusting. So here we go, Miss Nurse Jamie. You ready?
Ready.
All right, so now I'm going to palpate each level. So C2 is out on her left. C3 is out on her right. Ooh. And you feel that? Yeah. C7, T1 is out. Okay, so that area goes to her hands, which can cause the tingling and the numbing. So let's get started. So we're going to actually relax and hi. Good morning to you. How you doing?
Little gift.
Oh, fabulous. Okay, I'm going to go the other side. Right there. And relax. There we go. Beautiful. How's that?
Great.
Great.
Wonderful.
Wonderful. It's like, such relief. Tension gone. All right. Okay, so now the rib. Okay, is that a little tender still? A little baby one, not a big mama one like it was, because we took the primary subluxation or misalignment out of the equation. So then that minimizes the tension in the level below. Okay, honey, chin up a little. Good, little baby one. Very good. Okay, now is that better?
Yes.
Wonderful, good. And sometimes when we adjust, not every time, we hear that sound. And sometimes when we adjust, we hear nothing. But doesn't mean it didn't move. There wasn't enough air gapping between the joint segment. So don't be addicted to crack, okay? Because crack is whack. Okay, now I'm going to check her cranials. Okay. So, the skull bones actually, is that a little tender?
Yeah.
Yeah. They could ridge and jam, causing tension underneath. This is where I'm pressing on Jamie. It's called the sphenoid bone. And the sphenoidal suture line right here. internally, that's where the brain attaches to the skull area. So it's really important that we take that flat cranial plate and reposition it so that it connects properly to the adjacent cranial plate. Okay, good. Good. How's that? Say that for the mic.
Better.
Okay, good.
I'm like,
Excellent. Woohoo, woohoo. Okay, good. Let me check the back region. Okay. You feel that, yeah? Yeah. So that's the occipital line. That's where the cerebellum actually sits internally. That is a key area for your motor nerve function, like coordination. Okay, muscle function is key area. Right there. You feel that, yeah?
Yeah.
Okay, good. So every visit I'm checking every patient's cranial alignment as well as spinal alignment and as well as extremity alignment. It's a whole body adjustment instead of just cracking you per se where you may have a symptom. The goal for each visit for each patient is that you leave here balanced neurologically, muscularly, and structurally. Therefore, you can process life much easier. That's the goal for each visit. Okay, good. Very went. All right, my love. Now, let's check you. No, I forgot one area. Pardon me, pardon-moi. I'm going to check your ankles. Okay. Good. Good. Beautiful. And her cuneiforms are, you feel that, right? Yeah. So the arch bone is dropped, so I'm going to adjust the arch bone so that it's more comfortable when she's bearing weight. Now I'm going to pull your socks in so people don't think you have a big foot. Okay, how's that?
better. Yeah.
Excellent. This one's fine. That one's in. Okay, so now I'm going to check Jamie face down. You ready, my love?
Yes.
Okay. All right. Okay. So as you've seen in prior episodes, I always, again, check the leg length to see how the posterior area is doing compared to the anterior area of the body. All right, so Jamie's presenting face down, a short left leg. So you're like, hey, I thought you fixed her face up. Well, here's what happens. When you put pressure on the spine in a face down or a face up position, it changes the dynamics of your structure, okay? So then you can have a different presentation. This short leg in the face down prone position is probably because her pelvis is rotated and locked. So that doesn't show up when you're face up. So let me go ahead and assess that right now. And bend your knees, honey. So I put equal pressure on Jamie's ankles. But you see, get a close-up shot, Dina. And to show, go like that. Do you see? The left leg is further back than the right leg. So I'm going to adjust her left sacroiliac joint. Clear that out. And recheck. Voila! As they say in France. And so that took out ½ inch. But there's still a short leg on this side. So now I'm going to assess her prone and unwind the rest of the spinal cord tension. But her hips elevated, so I'm going to see which way to correct Jamie. What I'm doing right now is a torque assessment, temporarily challenging nerve and muscle tissue in that area to turn or unturn, clockwise, counterclockwise. Different checkpoints in the spinal column. As you can see, I get way more than 10,000 steps a day, okay? All right, so far, Jamie's balancing when I go counterclockwise at the checkpoint levels. Plot twist, except for the upper cervicals, get short again when I go counterclockwise. So, cranials, occipital, yep. So, the occiput and upper cervicals go one way and the rest of her spine go another way. So I'm going to calibrate my instrument that does torque release adjusting. Okay, good. Far better. Now, this is going to be a combo adjustment because we're still in need of doing some manual adjusting to get her structure to move because I just released nerve tension and nerve rotation. All right, so Jamie's shoulder is presenting higher on the left compared to the right. Let's bring your left arm back. What I'm doing right now is called the mirror image adjustment. So, however you present on the table, I'm going to put your body in the mirror opposite. So when I impulse, it neutralizes that posture pattern. Instead of moving into the abnormal position, we move away from the abnormal position, if that makes any sense. It's physics. It's called mirror imaging. Okay. And I also have a roadmap. Okay, this is Jamie's chart of progress, and I know what angles are where. This is far less than when we started with, but she still has a few angles we have to correct. Okay. All right, love, take a deep breath, and let's release it. Exhale. Beautiful. Bring it down. Let's take a deep breath, and exhale. And there we go. Good job. So we're going to do her lumbar spine. Let's go right side down, Miss Jamie. Okay. So Jamie has a 5-degree curvature in her lower back. So I'm going to adjust the apex and straighten it out, okay? Okay, let it release. Relax your belly. Beautiful. Let's go tummy down. Perfect. Perfect. And now you hear it again. You're perfect. Tiny little thing I got to address. Her occiput is sitting, her back of the head is sitting a little lower than the left, so I'm going to clear that out too. And this is going to be a drop adjustment. So the high velocity, meaning it's going to move fast, and it's going to be low force on the patient's head and spine. So here we go. And her head is on straight now. Beautiful. All right, my lovely. You are all fabulous. Have a seat. And she's getting up exactly how I taught her, which is fantastic, like a little Miss Mermaid. Okay.
My lashes still on?
Your lashes are still good, girl. Because lashes are everything. There's going to be a future segment on how to do these correctly. Gentlemen, you don't have to worry about it unless you know you do that kind of thing. Anyways, how you doing?
Great, amazing.
Okay, she's all relaxed. That's the purpose of an adjustment, to take all tension out of the body neurologically, structurally, muscularly, so everything processes fast and well, so you have a great day, okay? So I'll see all y'all on the next one.